Alright, so once again, good morning everyone. So for today class, our discussion will be about effective patient interactions. So part of our job kasi class as a pharmacist would of course be talking to our patients. Okay, especially class when it comes to OTC preparation. Because as I've said during the intro part, okay, probably because one of the most difficult things that we can do as a pharmacist is to give advice, especially with regards to OTC preparation. Because if it's an RX drug, okay, normally class it would be the physician who would be responsible for deciding on what medications the patient should take. But when it comes to OTC class, oftentimes our patient depends on the advice that we give. Or probably the advice of their kamag-anak, siguro, or kapitbahay. Okay, so that, it depends. Okay? So, in our case class, as a pharmacist, especially if you are a pharmacist in the community, so again, most of our patients class would be depending on the knowledge that we have, okay, uh, to make decisions regarding their medications, their health, and so on and so forth. So since we are most likely class to interact with our patients, so it's very important that we identify or we learn how to interact with them effectively. Okay, now of course class, the way we interact with our patient depends on the experience we have. Okay, this is something class that is usually not taught. You cannot learn this fully in school. Sa school class, you just get concepts. Okay, what are some advice, kumbaga. But the application of this class would always be when you start working na. Okay, or when you have your internship. Okay, and so on and so forth. So pharmacist class are basically the first healthcare professional that often sees patient. Okay? So sabi ko nga sa inyo before class, whenever we have patients who are sick, okay, when they feel unwell, do they go directly to their physicians? Okay, nagpapatingin ba agad sa mga doktor? So parang malamang sa malamang class, hindi. Lalo na kung lagnat lang naman, sinisipon, makati ang tenga, okay, namamaga yung mata. Oftentimes, class, patients don't go directly to their physicians. Okay, what they do, class, is they first visit the pharmacy to treat their own condition. Now, class, is it wrong to self-medicate? Okay? In your own opinion, class, is it wrong to self-medicate? Or is it advisable? Excuse me.
No, sir.
Yes, Mr. Albert?
Um, it's better to consult first before self-medicating.
Okay. All right. So that's your belief, right? So tama rin naman. You need to consult first before you start self-medicating. Okay, baka mamaya kasi um mali yung tinitreat mo na naman. Okay, anyone else who would like to share? Okay, sige, okay lang yan. All right. So class, well, usually you have to look at it in this way. Okay, is it bad to self-medicate? Well, if you're doing it wrong, then definitely class, especially for the patients, kung mali ang ginagawa nila, that's definitely harmful. That's why class, it's important that we are there as pharmacists to give them advice. Okay? We actually class promote self-medication, pero with the advice from a healthcare professional. Now, do we, as pharmacists, do we charge? Okay? Naniningil ba tayo sa ating consultations? So, di ba malamang sa malamang hindi naman, right? It's usually a free service that we offer to our patients. So, hence, class, let's maximize, okay, I hope the patients can maximize the expertise of the pharmacist, right? So that they can do proper self-medication. Now, if you can still remember, class, during the intro part, okay, I've shown you some studies, I've shown you some data that most people self-medicate, okay? And it's not wrong to self-medicate, provided that you have the right information. Okay, let's say for example, if you start self-medicating like for acne, tapos sabi ng kapitbahay mo, gumamit ka ng clindamycin, ihalo mo sa Eskinol. Okay, now of course that's something wrong na class because oral clindamycin was not prepared to be combined with Eskinol. Okay, it might work for some, it might not work for others. Now, just so you know, class, there is already a OTC preparation of clindamycin na pinapahid. Okay, I think it's a cream or is it an ointment? I'm not sure. Okay, pero that one, class, would be much better than compounding your own clindamycin topical agent, okay, with the use of eskinol, right? Okay, so pharmacist class can help our patients in 3 ways. Like, say, for example, either recommending no self-treatment, meaning the patient's condition cannot be managed by themselves or using OTC preparation, or the pharmacist can recommend self-care therapy. Okay, yan ang gusto sana natin. Wherein a patient class comes into your butika, hindi malala yung condition, right? And it can be managed through self-care. Or if darating ang patient class and you see red flags, okay, you see red flags class, then that will be the time that you would most likely want to refer your patient to your healthcare professional. What are these red flags? Okay, I'll give you some examples later on. Okay, pero basically class, these are the 3 ways, okay, where us pharmacists, we can help our patients. Either recommend no self-treatment, or recommend self-care, or refer our patients to their physicians. Right? So, 3 steps in the process. So, first class, you need to assess our patient. Okay, kasi for us to identify whether or not a patient can be managed through self-care, we need to assess them first. Okay, systematically reviewed the patient's drug-related needs, including identifying any of and all drug therapy problems. So I think this is something, class, you've already learned in clinical pharmacy, right? Whenever we do assessment class, as pharmacists, okay, I'd like to highlight this. As pharmacists, okay, our job, class, is to identify drug therapy problems. Okay? Do we diagnose patients? Is it part of our assessment? Do we diagnose our patients? In your opinion, class, do we diagnose patients? Yes. Miss Valencia? No. Okay, no. Definitely no. Okay, sa tingin mo bakit hindi tayo nagda-diagnose?
It's not part of our scope.
Okay, I'll take that. Tama yun. Hindi siya part ng scope ng ating trabaho. And class, we are not trained to diagnose. Okay, it's not part of our training. But it is part of our training to identify possible drug therapy problems. Let's say, for example, you see a drug interaction. You see a possible adverse drug reaction sa patient. May allergy siya, nakita mo. Allergic siya halimbawa sa paracetamol, sa ibuprofen. Okay, then the doctor prescribed the patient ibuprofen or Alaxan. Okay? So those are the things, class, that we are trained to do. Okay? We are trained to identify any problems that may arise from a patient's drug therapy. Okay, that's our training. We are not trained to diagnose. However, class, as a healthcare professional, it is also part of our training class to identify minor problems. Okay, what do I mean when I say minor problems? These are problems, class, that can be managed through self-care. Okay, or through the use of OTC preparations. Okay, minor problems. Meaning, class, minor problems are things that can easily be managed via OTC preparations or through self-care. Kasi, for example, acne. Okay? Sa acne, class, that's easy to manage, right? Usually, we have preparations available for that. Benzoyl peroxide, and so on and so forth. Okay? So, class, it's our job as a pharmacist to identify what are these minor ailments that we can manage, okay, and what are the conditions, class, that we can no longer manage. So that's part of the assessment that we do, okay? And of course, class, one of the major things that we need to identify when we assess our patient is the drug therapy problems that they might experience. Like, say, for example, wala siyang gamot for certain conditions, okay? Next step is to create a care plan, okay, or detailed schedule that outlines both the practitioner's and the patient's activities and responsibilities, and so on and so forth, to prevent any potential drug therapy problems. And then lastly, class, is to evaluate our patient's outcome. Okay, now, most of the time, class, here in the Philippines, okay, ang nagagawa lang natin is 1 and 2. Rarely do we evaluate our patient's outcome, right? We never do follow-up, right? Okay, as pharmacists. Doctors would request for follow-up, pero parang ang rare, I won't say rare naman talaga, pero madalang, class, na nagpa-follow up ang mga patients if they feel well na. Tama ba? I'm guilty of that. Okay? When I started feeling well, I didn't go back to my physician anymore for a follow-up checkup. Kasi sabi ko, okay na ako eh. Right? So, of course, that's wrong. Okay? So, huwag niyo akong gagayahin. Right? Pero that's something, class, that is inherent to Filipinos. We rarely follow up. Why? Because class is going to be an additional cost. Buti sana kung libre lang yung follow-up, right? Okay. Kaya nga, class, isa sa mga lagi nating sinasabi, or that's why we promote self-care as well. Because class, through self-care, we prevent our patients from getting worse. Right? That would merit a consult to a physician, which would merit a hospitalization, which would, of course, add on the healthcare costs, okay, of that individual. Right? Okay. So, class, just a recap. What are the drug therapy problems that we have? So, basically, class, we have 7 drug therapy problems. They are as follows. Unnecessary drug therapy, wrong drug, dose too low, dose too high, ADR, inappropriate adherence, and needs additional drug therapy. So let's try to have a review of the various drug therapy problems. Okay, this is very important, class. You learn how to assess and identify drug therapy problems. Okay, let's say, for example, for the first drug therapy problem, unnecessary drug therapy. So this could occur when the patient has been placed on too many medications, okay, for their conditions, and the drug is simply not needed. Okay, a very good example of this, class, that you can often see in a hospital setting is bibigyan lagi ang patient. Any patient to, ha? Basta na ER yan. Okay, na ER ang patient, class, kadalasan binibigyan ng omeprazole. Or any PPI. Have you noticed this? IV pa yung bibigay sa iyo, ha? Pag ikaw ay na-admit sa ER. Kahit wala kang GI complaints. Have you noticed this, class? Okay, I think most of you haven't worked yet, right? Or not yet working. Okay? Pero one thing, class, you'll notice in some, I'm not saying all, pero in some hospitals, class, okay, darating ang patient, ang complaint halimbawa is headache. Bibigyan siya ng gamot, class, for headache, pero sasabihan ng PPI, ng omeprazole. Ano ang rationale? Ang rationale nila is, as prophylaxis daw, baka ma-stress, sumakit ang tiyan, ganyan-ganyan. Pero in your opinion, class, will the patient need a PPI? Eh, ang primary complaint niya is headache. Okay? What will be your opinion about it, class? Okay, what would you say? Anyone? Okay, anong masasabi mo sa doktor or di kaya sa nagreseta nito?
Hello, sir.
Yes, yes.
So, for the what was the question again? I'm sorry.
Oh, sorry. If you were if you experience, okay, as a pharmacist, all right, you see a patient whose primary complaint is headache, then a doctor prescribes them with a PPI. How would you react to that?
Oh, okay. So, we can maybe inform or just remind the doctor that the PPI,
yeah,
more for like the gas or the indigestion or the acid.
Yeah.
So we can suggest alternatives instead. So maybe aspirin or like ibuprofen
for the headache.
Yeah, for the headache.
All right, very good. Thank you very much, Mr. Albert. Okay, so tama yun. Okay, we can do that. Okay, we can just recommend, class, to our physician, okay, that, ma'am, doc, most likely baka hindi po do kailangan ng ating ng patient because the primary complaint is GI. The primary complaint is headache. Okay, not GI. So therefore, class, we can recommend probably any medications that can be used for headache, not necessarily for the GI. Pero now, class, pag sinabi ng doctor, hindi, we're just using this for prophylaxis. Okay, remember, class, this is an additional cost for the patient. Okay, and do they really need a PPI? Okay, so you might want to contest that with the doctor, but do it in a very respectful manner. Okay, kasi, class, sometimes they become defensive pag pinupuna natin yung kanilang mga pagkakamali. Right? So, yun. So, most likely, it's an unnecessary therapy, right? The patient doesn't need it. It's just additional cost. So, you might want to remove it from the patient's drug list. Okay? I remember class in the US, one of the jobs of pharmacists, especially pharmacists working for an insurance, okay, they do drug therapy monitoring, TDM, or therapeutic drug monitoring. Okay, and one of their jobs class is actually to identify unnecessary drug therapy, because if you're working for an insurance, the insurance class will be paying for those medicines. So, as a pharmacist, if you are able to remove some medicines that are unnecessary or not needed by the patient, you actually get incentives out of it. Okay, the pharmacists get incentives. So, sabi ko nga, tanggalin ko na lang lahat ng gamot ng patient. Ano? So, syempre, hindi naman pwede yon. Okay, because the patient would most likely need certain medicines naman. Pero it's part of our job class to identify what is unnecessary or what medicines are no longer needed by the patient. Okay? It might result lang kasi to drug-drug interactions, or yun na nga, walang silbi yung patient. Wala namang silbi yung gamot sa patient natin. Anyway, wrong drug class is very self-explanatory. Okay, this could occur when a patient is given a medication that does not treat the patient's condition. Let's say, for example, okay, very typical class. A patient comes into your pharmacy complaining for cough and colds. Okay, cough and colds. Then patient has no fever and is asking for antibiotics. Okay, if you give antibiotics class, that's classified as wrong drug. Why? Because antibiotics are designed to combat bacterial infection. And most cough and colds class are viral in nature. Okay, so that's one of the reasons why, class, I'm really proud of our pharmacies nowadays. Okay, most of our pharmacies, especially the small time, or in class, when they are faced with people buying antibiotics, what do they often ask? May reseta po ba kayo? Okay, meaning were you assessed by a healthcare professional? Kasi kung walang reseta, class, then that means that might be it might be inappropriate, okay, for the patient to use antibiotics. Okay, so that's wrong drug. Now, class, what sign would merit the use of an antibiotic? Okay, if a patient goes to your pharmacy complaining of cough and cold, what sign would merit the use of an antibiotic? What sign or symptom? Anyone? Okay, during your interview process, class, when you're interviewing your patient, what would you be looking for? Okay, that would tell you that, most likely nga kailangan ng patient ko ng antibiotics. Anyone? What would tell you? Yes, very good. Okay, very good, Mr. Santiago. Fever, right? Pero class, not just any ordinary fever, ha? The fever class should be at least higher than 37.8. Okay? And the fever class, this is the keyword here. The fever should be at least, or should be more than 3 days or more. Okay, fever should be 3 days or more. Kasi class, when you have a viral infection, you'll get fever, but it's not that high. And normally, class, on the 3rd day, it wanes down. Okay, nawawala yung fever after the 3rd day if it's viral. Okay, pero if it's bacterial, class, the fever will persist for more than 3 days. 3 days or more. Okay, that would merit the need for the use of antibiotics. So you might want to refer now your patient to their physician. Anyway, so dose too low, obviously, patient is not getting the maximum effect from the drug because the dose can be too low. Now, what could lead to a dose that is too low? Well, obviously, if the medication should be given as 500 milligrams, then you give it at 250, might lead to dose too low. Or there are drug interactions, class, that would facilitate a reduction in the drug's absorption, right? So ang daming scenario na pwede mangyari dito. Pero basically, class, what you have to remember about dose too low is whenever the drug that reaches the bloodstream is not enough. Okay? What about dose too high? So it's the opposite of dose too low, wherein your patient is receiving too much. Okay? Or the drug is too strong for the patient, causing detrimental effects. Okay? Okay, so what could cause dose too high? Again, it could be a drug interaction. again, which leads to an excessive amount of drug in the circulatory system, and so on and so forth. So next one is adverse drug reaction. So this could occur when a patient has an allergic response to a medication. Okay, we can classify this as ADR. Inappropriate adherence, meaning the patient chooses not to or forgets to take medication. So that's inappropriate adherence or inappropriate compliance. So it's part of our job class as a pharmacist to remind our patients to take their medicines, okay, to update them every now and then. Okay, and the last class would be needs additional drug therapy. So meaning, as a pharmacist, you are able to identify a therapeutic condition, a condition of the patient that might warrant, okay, the use of additional drugs. Right? Let's say, for example, may patient ka has fever. Sorry, for example, has an infection and has fever. You saw sa patient na meron na siyang antibiotics, okay, for the bacterial infection, but you didn't find any medicine for the fever. So you might want to recommend the use of antipyretics, say, for example. Okay, so that's adding to the drug therapy of the patient. Right? So the two major components class of an effective interaction would be how organized the interaction and how well the pharmacist uses communication. Now, truth be told, class, not everyone can communicate properly. Do you agree? Some people, class, were made to be, were more of a, how do you call this? Ang expertise nila is more on identifying problems and so on and so forth, but not communicating with patients or not communicating with people. Okay, we have people who are introverts, right? Okay, some people naman flourish through interactions. Okay? So sila naman yung mga extrovert natin. Magaling makipag-usap, maboka, machika. Okay? So if you're a pharmacist class and you're working in a community setting, okay, one of the primary skills that you might want to have, class, would be communicating. How to communicate properly. Now, if you are someone, class, who you know you really can't communicate properly, okay, you might want to consider, class, other career. Huwag naman. Okay? Well, kung kaya nyo ma-overcome yung shyness ninyo, okay, the better. Right? Pero nowadays, class, sabi nga natin, in this day and age, we don't force people to do what they don't like. Okay? Kasi if they can shine in other fields, then why not? Okay? Yan. So, anyway. Okay, so what are the components of an organized approach? Okay, so first, class, you need to be able to do assessment and triage. Okay, counseling and then follow up. Now, what is done during assessment and triage? So, class, during assessment and triage, you try to identify the nature of your patient's concern. So, ito, nature of patient's concern or the symptoms and evaluate the amenability to self-treatment or the need for referral. So, during assessment and triage, class, you try to look at the patient, okay, whether or not kaya ko bang i-manage ito with the use of OTC. If you know, class, that you cannot manage it with the use of OTC, then you might want to consider referring the patient to a physician. Okay, so as a pharmacist, class, it's also important that we have a list of physicians that we trust, okay, that we know can manage our patients. Because that's what's done during assessment and triage. Now, normally, class, during triage, ito yung part ng interview process wherein you try to identify whether or not, you prioritize, okay, or you assess the patient based on their priority needs. Okay, are their needs immediate? Okay, are their need or can their concern be managed through self-treatment? Or, or do you need to refer the patient to a physician immediately? Okay, so that's what's happening during assessment and triage. Right? So what to say when assessing a patient? So you introduce yourself, find out briefly what the patient needs. Normally, you use open-ended questions here. Okay, ensure comfort and privacy. Explain how you can help as a pharmacist. So proceed with questioning for assessment and triage, referral, and then counseling. Now, class, if you'll notice, one of the most successful small-time pharmacies here in the Philippines, okay, yung pinaka-successful, class, kadalasan ay yung mga pharmacies that offer patient counseling. Sila yung binabalik-balikan because alam nilang the pharmacist cares for them. Okay? Just like class with my cousin. My cousin class is owns a small pharmacy. Okay, tinatabihan siya ng malalaking butika. Pero if you'll notice class, araw-araw kahit maraming butika sa paligid niya, yung mga patient sa kanya pa rin pumupunta because yun na nga, may added service yung pinsan ko which is patient counseling. Okay? At maboka talaga yung pinsan kong yun. So when you introduce yourself class, obviously give your name and your profession. Sabihin mo lang, hi, I'm the pharmacist here. My name is ganito, ganyan. Okay, so create a rapport. So find common grounds with your patients. Ask trivial things like the weather, sports events, etc. Avoid talking too much about yourself or asking direct questions about the patient. You don't want to ask class patients direct questions because you don't want to be too privy. Okay, you don't want the patient to think na, ay, pagchichismisan lang ako nito. Or you're asking private information. Okay? So just ask class simple questions like, oh, how are you feeling today? Okay? Or ask about sports. Depende. Just try to look for common grounds. Okay, hi. Nice weather we have today, right? Okay, pero that's more of Americano. Okay, usually sa Pilipinas, if you want to get a common ground, okay, try to identify a chismis. Oy, nabalitaan mo ba si ganito, si ganyan? Okay, pero I'm not saying na ganun dapat ng, ang pag-usapan ninyo, pero try to find common grounds. Okay? Just so mag-relax yung patient sa'yo. Okay, then find out briefly what the patient needs. Normally, class, you can do this in a few minutes lang. Okay, so how can I help you? What brings you in today? So, bakit po kayo napunta sa ano? Okay, I'll give you an example, class, one of my experiences. Okay, sometimes kasi I go to my cousin's pharmacy. Nagbabantay ako minsan para sa kanya. Okay, I try to help out. Okay, I remember oftentimes, class, the cases that we get in the pharmacy would be for children. Okay, pero there was one time, class, I experienced wherein patient comes to the pharmacy trying to buy hydrogen peroxide. Okay, so obviously, pakilala ko. So, ako po yung pharmacist po na dito. So, pansin ko po, bibili po kayo ng hydrogen peroxide. Para saan niyo po gagamitin? Okay, so I'm not trying naman to be privy naman too much. Pero, of course, I tried to say it in a nice way. Okay, sabi sa akin, kasi maano yung tenga ko eh. May parang nabibingi daw siya. Okay, so sabi ko, oh, have you, nasumubukan na ba ng anything else? Okay, so nasubukan niya na raw maglagay ng baby oil. Alright, to no avail. So she wanted to try hydrogen peroxide. Okay, so by asking those questions, kasi I was able to find out na may problem yung ear niya. Okay, so next one is to explain how I can help. Okay, I may be able to help you feel better. I'll need to ask you a few questions about how you are feeling to make sure it's something one of these products can help. Okay, so I tried to ask, ano po bang naramdaman nyo? Okay, so kasi sabi ko, through experience ko, alam ko rin yung pakiramdam po ng parang nabibingi. So usually may tutuli lang naman dyan. Alright, so through the class, so by asking them question, I was able to find out nga na mukhang most likely may tutuli siya. Wala naman daw pain, walang fever. Kaya yun kasi una ko tinatanong is there pain? Is there fever? Because if those things are present, class, automatic, okay, you will immediately want to refer the patient to a doctor. Pain and fever kasi, class, are signs of infections. Okay, that's not something you can just treat on your own. Right? So anyway, so malamang sa malamang, meron siyang impacted ear. Okay? The use class of hydrogen peroxide, especially the diluted hydrogen peroxide, okay, can be very useful to dislodge any tutuli, especially if it's loose lang naman. Okay? So it's very useful. So, long story short, class, okay, binigyan ko siya ng hydrogen peroxide, binigyan ko na siya din ng instructions on how to dilute it properly. Okay, usually, half and half lang naman yun, half water, half hydrogen peroxide, 6%. Okay? So that you can just get enough hydrogen peroxide to dislodge any loose tutuli or to, what do you call this? To melt any excess tutuli. How do you say that in English? Plugged earwax? Hardened earwax? Yan. Yan. Okay, so you can do that. Right? So that's one of the recommendations that you can give. Nasabi ko sa kanya, ma'am, pag andyan pa rin yan after 2 to 3 days, okay, please make sure that you visit your ENT. Okay? So, ayun. Okay, now class, it's not advisable then to give hydrogen peroxide too much kasi it's going to alter the normal flora of your ear. when it alters the normal flora of your ear, class, you become more prone to having infections. Okay, similar to me, I did that before. Okay, I self-medicated. Sobrang laki pala ng impacted ear ng earwax sa ear ko na hindi siya matanggal ng simple what do you call this? Simple hydrogen peroxide solution lang. Okay? So what I did, I actually applied hydrogen peroxide almost every day for a week. Okay? Then what happened to me? I got otitis media. Okay? As in nagkaroon siya ng pain. Right? So by that time, class, then nagpa-check up na ako. Okay? So wag niyo kong gagayahin. Right? That was way before pa naman. Bata. Okay? During my younger days. Okay? So, yeah. Wag niyo akong gagayahin, ha. Right? When you feel something wrong na talaga, class, and you know it's not going away in 3 days, it's time to visit your physician. Anyway, so ensure comfort and privacy. Provide a tissue, especially kung naiiyak-iyak yung patient. Offer water, chair. Ask if the patient would like to talk about it in a more private area, or ask if there's a need for medication now. Now, do we always do this, class, especially here in the Philippines? Malamang sa malamang hindi, right? Because we have a lot of patients that we need to accommodate. Okay, it's very difficult for us, class, to offer these kinds of services to our patients. So most often than not, class, okay, we try to, ano ba ito tawag dito? Okay, we try to give them comfort. Okay, pero we have to assert din naman that hindi natin kayang bigyan solusyon yung kanyang problema. Pili ko alam naman yun ng patients. Okay, pero at least we try to offer help. Yun lang. Okay? We try to offer help. Okay, pero we can't accommodate to their problem, especially kung financial yan. Ano yan? Pauutangin ko ba sila? Okay, and so on and so forth. So proceed with questioning for assessment and triage. Okay, so move to a more close-ended questions to gather more focused information regarding red flags. Okay, these are the things that we often ask. Okay, we try to close-ended questions are often asked to identify for red flags, duration, how long is the symptom. Kasi class, again, the magic word here will always be 3 days. Okay, if it's 3 days or more, consult a physician agad. Okay, onset, frequency, how often does it happen? Where is the pain located? Say, for example, severity, associated symptoms, things that makes the symptoms worse or better. Let's say, for example, patient is experiencing upper epigastric pain. Tapos it's always worsened by a meal. After eating, sumasakit daw siya. You might want to suggest to the patient to consult a doctor. Baka mamaya gallstones na yon. Okay? Effects on activities of daily living and medications already tried. Why is this important, class? Medications already tried. Ask for this one. Why do you think so? Okay, why do you think, class, it's important to ask the patient of what are the medications they've already tried? They've already tried. Okay? Okay. Sige, carry lang yan. Okay? So oftentimes, class, we ask our patient, yun, possible ADRs? Okay, pwede. Kasi baka mamaya, yung na-experience niya pala is because of ADRs. Right? Pero normally, class, you ask for medications that the patient has already tried to address their problems, ha? Okay? In order to identify, class, kung ano yung effective at hindi effective sa patient. Kasi, for example, may lagnat, gumamit ng paracetamol, na-reduce yung fever. So, alam mong effective kay patient yung paracetamol. So, you might not want to remove that from the patient's medications. Okay, you might want to add, like say, for example, patient is experiencing fever, relieved with paracetamol, pero it doesn't go away, baka mamaya, it's a possible infection. So, you might want to refer the patient not to the physician for them to get a prescription for antibiotics, say, for example. And so on and so forth. Okay? So, normally, class, ito yan. Yes, you might want to ask for certain, ano yung mga nagamit yan ng gamot to assess for possible ADRs, or, better, to know what is working, what has worked, and what is not working for the patient. Halimbawa, gumamit ng paracetamol, hindi na-alleviate yung headache. So, baka hindi na effective sa kanya yung paracetamol. You might want to escalate the patient's analgesic. Next one, so when to use open-ended questions. Normally, class, you use open-ended questions to identify a patient's symptom. Okay, ano pong nararamdaman nyo? Right? So when you need to begin a line of questioning or to convey a willingness to listen. So oftentimes, class, you use open-ended questions when you want to determine the patient's understanding, okay, level of sophistication of their assessment, and what level of vocabulary would be appropriate for you to use. Okay? It's also used, class, to promote rapport and trust. Right? So, halimbawa, tanong mo sa patient, can you describe to me how you feel? Ano po bang nararamdaman nyo? Okay? Ganong, mga ganon. Now, when do you use close-ended questions, class? When you want to get specific answers. Okay? Or you want to gather focused information. Normally, dito natin sasabihin, gaano kasakit? Okay? Or di kaya, gaano katagal na po yung symptoms? Right? Or when you need to gather information quickly. Okay? Or, you use close-ended questions, class, to keep a talkative patient focus. Naku na, class, napakarami ng ganitong klaseng pasyente kapag ikaw ay nagbobotika. Especially if the patient is an elderly. Okay? Minsan yung mga elderly, gusto lang talaga makipagchika yun. Now, class, tandaan nyo, isa sa mga pinakamagandang source of revenue. Source of revenue ba talaga? Okay? Pinakamagandang client sa isang butika, class, would be the elderly. Kasi sila yung may loyalty, kumbaga. If they like you, class, they will really stay sa butika mo. Okay? They will become your loyal customers. Okay? Alright. So next in class is when we talk to our patients, we try to use layman's term as much as possible. So these are just some examples, class, of sophisticated terms with their counterpart. Okay? Na layman's term. Let's say, for example, productive. A lot of phlegm. Marami po bang phlegma? Okay, di ba? And so on and so forth. So these are just examples, class. So you are listening. Okay, here's the thing, class. Minsan kasi, we, how do you say this? We convey a different message to our patient using our body language. Let's say, for example, class, the patient is explaining what they feel, pero tingin ka ng tingin sa cellphone mo. Okay, nakayuko ka halimbawa, tapos tingin, ganyan. Right? So, class, that conveys, of course, a message that you're not actually listening to the patient. Okay? Pero minsan kasi, class, tumitingin ka lang naman sa cellphone mo to check kung ano mga pwedeng gamot sa kanya, right? Okay, pero anyway, class, so these are the signs. These are the things that you need to do, okay, to convey the message, class, to the patient that you are listening. Kasi when you listen, class, okay, they become more open to you. And by becoming more open to you, class, okay, you get their trust. Okay, you get your patient's trust. And when you get their trust, class, they will come back to your pharmacy more often. Right? So you encourage them to talk. You wait during silence. Okay? You repeat what they're saying in your own words. Right? You reflect. So, ibig sabihin po, matagal nyo nang nararamdaman yung sakit na to. Okay, you explore, you summarize accurately, you ask questions, and you paraphrase what they're saying. Okay, di ba parang talk back? Okay, you are not listening when you are in a hurry. You interrupt them. Okay, change subject for no apparent reason. You ask question twice. Okay, sabi niya, nasagot ko na yun, ba't mo natanong ulit yun? Ibig sabihin, hindi ka nakikinig. Okay, or you don't ask any question at all. Okay, you are talking, you don't allow the patient a chance to finish what they're saying. Okay, and you lecture or cut off expressions of feeling, and you give advice prematurely. Sabi mo, hindi, ganito gawin mo. Ganyan. Okay, so those are signs that you're not listening. Alright? So proceed with questioning for assessment and triage. So usually, you can conduct appropriate basic physical assessment if required. Okay, determine if drugs or certain medical conditions are causing the symptoms. Avoid counseling or providing information until you have gathered all information to make a full assessment. Right? Pero class, normally when you start to counsel, this is something that you develop through experience. Again, okay, these are things that you don't really learn sa school. Okay, you get the idea, class, pero it's better to practice. You learn this through practice. Okay? So here are some red flags, class, that you can often see, right? And its significance. Let's say, for example, there's fever in infants. Fever, class, will always be a common problem that you are faced with in a community pharmacy. And oftentimes, the fever could be a sign of infection. So these are just some. Okay, I won't be reading through all of them. Okay, I'll leave it to you guys to identify these or to read this. Okay? Okay. Ito nga, class. Oftentimes, class, ano ang sign for dehydration? What are the signs that you often see associated with dehydration? Yes, headache. Very good, Mr. Santiago. Okay. Headaches, class, can be a sign of dehydration. Pero headaches kasi is too broad. Okay. It can be too broad. Okay. Kumbaga, headache can be anything. It can be a simple headache lang, not necessarily dehydration. So what's a sign, class, that can help you identify dehydration? Okay. Pero headache is a good sign also. Okay. Sige, it's okay, class. Normally, class, you try to look at the patient's skin turgor. Okay? Skin turgor, class, is how elastic the patient's skin is. Normally, class, if the patient has good skin turgor, okay, pag inangat mo yung balat niya, okay, pag binitawan mo, bumabalik agad. Okay? If a patient is dehydrated, class, they lose their skin turgor. Okay, normally, pag inangat mo, dahan-dahan lang siyang bumababa. Okay? Yung skin ninyo. And that's a good sign of dehydration. Okay? Or if the patient is constantly vomiting or constantly having loose bowel movement, then the patient will be at risk for dehydration. So, kailangan ma-replenish agad. Okay? Okay. Ito, halimbawa, discolored urine or feces. Pag ang feces, class, is black tarry stool, then that could be a sign of internal bleeding. This one, class. Try nga natin. Class, what if your feces is meron occult blood? Meaning may tinge of blood sa feces. Alright? Kasi dalawang color na pwedeng lumabas dyan eh. Black tarry stool. Or merong occult blood. Now, class, if the patient is having black tarry stool, nasaan ang bleeding? Most likely. Where is the bleeding happening? Where do you think the bleeding is happening? Colon? Naa. Actually, class, if it's black tarry stool, nasa upper to. Upper gastric. Meaning, nasa stomach. Okay, that could be a good sign, class, that the patient might have ulcers. Okay, peptic ulcer disease. Right, which leads to black tarry stool. Now, class, kung may occult blood yan yung sa colon. Okay, most likely sa large colon. Merong ulcerations or may sugat sa colon ng patient. Kaya lumalabas ang pupu, may tinge of blood. Okay, may redness, may dugo sa kanyang pupu, yun na lang. That could be a sign, class, na sa lower gastric na yung bleeding. Pwedeng sa rectum mismo, baka may fissures doon. May may hemorrhoids which causes yung blood sa pupu, or it's somewhere along the colon. Okay? Now, class, do you know why your stool becomes black kapag sa upper, sa stomach? It's because, class, whenever you have ulcerations, pag dumugo yun, may acids kasi sa stomach natin. Naluluto, kumbaga, yung dugo sa acids. So, it comes out black and tarry. Kaya parang dinuguan, class, di ba? Pag naluto yung dugo, nagiging dark ang color. Or pag na-try nyo naman kumain ng Betamax. Okay? Yun. So, yun yung example noon. Right? So anyway, what to say when counseling patients? So it's important, class, that we establish goals, help them with their product selection, provide information about the products, okay? Then test their understanding, para ma-check kung naintindihan ba talaga nila yung sinasabi nyo, and then close your counseling. So when establishing goals, class, it's very important that you set expectations. What will happen to the patient? Will it cure or just simply manage the symptoms? Kasi, class, if the patient understands what's the goal, okay, then alam niyo expectations. Alright? So the patient's expectations will be tempered. Alright? Kumbaga, naisa-set niyo yung expectations ng isang tao. Mahirap kasi minsan, class, di ba? Pag hindi mo na-meet yung expectations ng isang patient, anong iisipin niya? Okay? Iisipin niya, hindi ka effective as a healthcare professional. Let's say, for example, expectation ng patient is, pagka-take niya ng gamot, isang take lang, tanggal agad yung symptoms niya. Hindi mo na-explain na it takes about 2 to 3 days bago mag-work yung gamot. Right? So, therefore, class, sabihin ng patient, ay, wala naman palang alam yung pharmacist na yun eh. Huwag din na ako babalik doon. So, tama ba? Okay, so it's very important, class, that you set expectations. Di ba? Parang ano lang din yan. Parang, halimbawa, nag-aaral ka. Di ba? May expectations ang magulang mo. So, sabi mo na agad sa magulang mo, mahirap yung kurso kong ito. Okay, I don't want you to expect too much from me. Okay, baka ma-pressure ako, hindi ako hindi ako makapag-concentrate. Okay, stuff like that. Right? So, find out time frame of expectations and explain reasonable time frame. That's why, class, once I start giving you guys some case studies to work on. Okay? Isa sa mga lagi kong hinahanap, class, during your SOAP analysis, especially pag naglalagay na kayo ng plan, is what are the expectations that the patient should, what are the goals? What are the expectations na isa-set mo sa patient mo? Will it be the cure of the disease, relief of the symptoms, and for how long before the patient can experience relief? Okay? So, mga ganon. Next one, help with product selection. So, find out what has or has not worked. Kaya nga importante tanungin ang patient kung ano na ba yung mga na-try niyang gamot. So, determine preferences. Okay, consider side effects, convenience, cost. This is probably the most important. Okay, beliefs and values. Ask about other drugs and medical conditions that might impact on choice. And if more than one product is available, explain the advantages and disadvantages of each. Okay, halimbawa, class, ang common na product selection na ginagawa ko would be sa mga bata halimbawa. Okay, may singaw sila. Kasi pwede ako magbigay ng Xylogel. Pwede na magbigay ng Dequadine. Okay, Dequadine would be it's very suitable, class, lalo kung malaki yung singaw. Natatanungin ko yung anak niyo po ba sensitive pagdating sa tastes? Kasi, class, masyadong maasim, parang mapait yung Dequadine. So, pag pinatak mo yun sa singaw, masakit. At the same time, it's going to taste bad. Right? So, pag sinabi sa akin na nako, medyo po yung anak ko dyan. So, oftentimes, class, I'll just recommend Xylogel for symptomatic relief. Sabi ko, hindi po nito pagagalingin yung singaw, pero tatanggalin na yung sakit na nararamdaman ng anak niyo dahil sa singaw. Kasi malamig-lamig yung Xylogel. It's cool. So, it provides relief, not cure for the singaw. Pero oftentimes, kasi wala naman ng singaw after a while. Okay, then just recommend that the patient or that the child does not eat anything that's too hard kasi baka lalo lang lumaki yung singaw. Okay, emphasize on important points. Okay, very important yan. And give reasons, right? Provide definite and explicit instructions including the duration of therapy. Very important. Okay, now class, pangit din naman pag masyadong matagal ang counseling natin. Okay, try to ensure, class, that you finish your counseling between 2 to 5 minutes. Maximum na talaga, class, yung 5 minutes. Minimum dyan, kahit ilang seconds lang. Okay, kasi, class, you want to catch the attention of your patient. At the same time, tandaan nyo, hindi lang naman yan yung pasyente nyo. Okay, ensure that your words cannot be misunderstood and consider using written information. Then, when you test for understanding, ask them for feedback. So, sabihin lang, okay, sir, ulitin ko lang po, paano po ba natin gagamitin ulit yung gamot na to? Okay, just check kung if the patient still remembers the instructions. Okay, ask for demonstration if applicable. Check for signs of understanding like nodding or yes. Minsan kasi nagna-nod lang, pero hindi naman talaga naiintindihan yun. Parang estudyante, right? Okay, minsan makikita mo estudyante, Okay, yun pala, wala talaga sa naiintindihan. Right? Kaya sabi ko nga, napakaganda na kapag online, nare-record natin yung lecture. At least, pwedeng balik-balikan ng estudyante pag hindi niya talaga naiintindihan. Okay, ask if there are any questions and clarify misunderstandings. Pero minsan, mga estudyante, hindi na rin binabalikan yung video. Bahala na si Batman. I can't blame them because most of the time din naman, class, some students have so many things to study. Crowded na kumbaga yung inaaral nila. Hindi na makatarungan ba? Buti pa nga sa PharmD, no? Ilan lang naman ang inaaral niya. At saka very focused. Really sa practice of pharmacy lang talaga. Okay, may it be in a community or a hospital setting. So next one is to summarize important points, acknowledging the patient's initial concerns and reiterating key counseling advice. Explain any monitoring and follow-up that should be done by either the patient or you, and arrange time and date to follow up if necessary. And end it graciously. So maraming salamat po. Balik po kayo. Okay? Pero sana pag bumalik po kayo, yung wala na kayong sakit masyado. Alright, so what to say at follow-up? Introduce yourself again, explain the purpose, assess the response, advise if necessary, then close the follow-up. Okay? So, wag na to. Alright. Advise if necessary. So, whenever you close class A follow-up, normally, you just simply summarize what you're trying to say. Okay? And ito pala importante, allow the patient to hang up first. Kasi baka mamaya may tanong pa pala sila, so bigla mo nang binaba yung phone. Okay, so whenever we're speaking class to our patients, allow them to hang up first. Okay? So here's the diagram on how we do a patient-pharmacist consultation. It can either be a patient-initiated, so yung patient mismo nag-ask ng question, or it can be pharmacist-initiated. Pero basically, class, we always start with historical and physical data. You try to interview the patient. Then we assess the patient's condition, whether or not it may merit a physician's referral, or kaya ko naman tong i-treat. Alright? So kung kaya ko naman as a pharmacist i-treat to, because it's just a minor ailment, halimbawa paso, sakit ng ipin, ganyan-ganyan, but of course you would recommend the patient to see a dentist. Right? So try to collect for more information if you need to. Then if you got enough information, class, then do treatment selection, advise the patient, and then ask for follow-up. Kung kaya. Here are examples, class, of historical data. Okay, I won't be reading through all of this. But basically, class, it's very important to always get the onset, duration, severity, and the description of the symptom. Okay? Ito, class, kung nasa community setting ka, it's hard to get this information, okay, without going into the realm of data privacy. Alright? Pero kung kaya mo naman, class, kung may database naman kayo sa hospital, sa inyong butika, then the better. Alright? So, physical data, if needed, pero kung hindi naman, normally, sa clinic na to ginagawa. Okay? Now, we don't do physical assessment right now sa Philippines. Right? Pero in other countries, class, they do. Okay? The pharmacist has their own room to do physical assessment if necessary. Okay? So, there are 5 specific areas wherein we can either collect for more information, refer na agad. Okay, minsan pag tinatamad ka, hindi, patingin na po kayo sa doktor nyo. Okay? Pero minsan sayang yung sales kasi na mag-generate nyo if you're able to give the patient medications. Right? Okay, lalo na class, Robitussin, ang mahal nun, 200 plus yun. Isang bote nun. Okay, so pag inuubo, I always recommend Robitussin. Because I know it works. Okay, it's an antitussive drug. Okay? And then monitoring and follow-up. So when to refer a patient to a physician? Obviously, when you see red flags or symptoms are too severe. Okay, pwedeng symptoms are minor but have persisted and do not appear to be due to some easily identifiable cause. Say for example, may headache. Tapos kasi sabihin sa'yo ng patient, isang buwan na po yung headache ko. Right? So that's something that I don't think we can simply manage with the use of OTCs lang. Okay? The symptoms have returned repeatedly for no readily recognizable cause, meaning pabalik-balik na yung symptoms. Halimbawa, sakit ng tenga. Okay? Lulubog, lilitaw, ulit-ulit siya. Or the pharmacist is in doubt about the patient's medical condition. If you're in doubt, class, again, refer the patient immediately to a physician. Okay? What about advising patient on self-treatment? Right? So give reasons for self-treatment, description of the drug and the treatment, okay? Then administration guidelines. Explain that to the patient, class, how much of the drug should be given. Normally, class, when a patient comes to the pharmacy with a prescription, tapos antibiotic halimbawa, I always reiterate, class, to the patient, gaano karami ang iti-take niya, for how long. Especially for children, gaano karaming in ml. Sabihin ko 5 ml po, papakita ko yung bubuksan ko yung bote, papakita ko yung cup. Hanggang dito lang po yung Alright? And so on and so forth. So, possible side effects and precautions. Pero normally, class, wala naman masyadong side effects yung mga gamot natin. Especially for OTC. Pero kung yan ay antihistamines, obviously, aantokin po kayo dito. Okay, that's a common side effect that we explain to our patient. Okay? And then general treatment guidelines. So high risk and special groups, these are the ones that we have to be wary when giving advice. Pediatric, dito ako lagi maingat. Okay, when I know I have a patient, a parent comes to the pharmacy, sa butika doon ng pinsan ko, then ang kanyang concern ay para sa kanyang anak. Oftentimes, class, I have my phone with me. I call my wife. Kasi ang misis ko ay may training sa pediatrics. Kaya hindi niya lang tinapos because of the pandemic. Anyway, so tatawagan ko yan. Oy, ganito ang problema. Ano pwedeng ibigay? Okay, so nakikita ko na-appreciate naman ng most parents. Okay? Most of the parents, class, appreciate it when they say that I call my wife. Sabi ko, wait ako, tatawagan ko lang yung misis ko, doktor po yun eh. Tanong ko, ganito ang problema niya, ano pwedeng gawin? So, yeah. So, they get free consults. Alright? Anyway, so yun, geriatric, madaling i-manage, class, pag geriatric, normally. Kasi, may mga, may listahan yan ng gamot. Okay, pregnant patients, this one's very difficult. Nursing mothers, patient with more than one ailment, or patient taking more than one drug. Okay, so these are the ones that we have to be maingat when we're dealing with these kinds of patients. So here, class, are some tips for special situations. So how do you deal with certain patients? So let's say talkative patients. Pag talkative yan, class, try to minimize your contribution to off-topic. Okay? Kumbaga, wag mo nang tanungin how's the weather. Okay? Or ganyan-ganyan. Minimize it. Acknowledge but continue questioning or counseling. Okay? Kumbaga yung nod pag may kinukwento siya. Ganyan. Pero try to control the conversation, class. Okay? Try referring back to the patient, to the discussion about the presenting complaint, and try to use close-ended questions. By using close-ended questions kasi, class, we try to direct yung conversation. What about if the patient is angry? Okay, acknowledge the anger. Sir, I understand that you're angry, pero try to de-escalate to, class. Ang usual na ano dyan ang usual na ginagawa natin is acknowledge the anger, yun na nga. Okay, sir, I understand that you're angry. Okay, pero I cannot help you, sir, kung kayo po ay nagsisigaw. Okay, or you're venting your anger at me. So I would like to help you, sir. Pero I cannot do that kung sumisigaw po kayo sa harapan ko. So let the patient vent their feelings, stay calm. Okay, wag niyong sabayan ang galit nila. Kasi pag sinabayan yun, class, sasabog lang kayo. Parang sa relasyon lang din yan. Okay, pag galit ang partner mo at galit ka rin, okay, walang mangyayari dyan. Okay, so try to stay calm, lower your voice, speak slowly, and maintain eye contact. Okay, pero minsan kasi hindi mo makapigilan, no? Pag atribida yung pasyente. If you are at fault, agree. Avoid being defensive. Okay, pero hello, pride ko rin, di ba? If the patient is depressed, upset, or crying, offer privacy, offer to call someone, ask is it something you want to talk about. Kasi kung ayaw naman nila pag-usapan yun, wag mo pag-usapan. If the patient is elderly, try to slow down your speech. Okay, wag kang magmadali. Mahirap sa akin to because if you notice, class, ang bilis ko magsalita. Alright? So decrease the amount of information given at once. Kasi malamang sa malamang, class, hindi ma-absorb ng patient yon. Okay, so try to limit the information you're giving to what's important lang. Okay, what about the non-communicative patient? Hindi siya nagsasalita masyado. So wait during silence so the patient can respond. Ask open-ended questions. And the patient who doesn't want to talk or take your OTC advice, okay, try to determine whether or not they have preference or explain the advantage and disadvantage in terms of patient's medications and medical conditions. Pero kung ayaw talaga, class, tanggapin ang advice nyo, di wag. Okay, at least you did your job. Okay? Patients with potentially embarrassing complaints, halimbawa hemorrhoids, ganyan, offer some privacy. Okay, and then use close-ended questions, class, and try not to delve too much into it. Okay, like halimbawa, nagbibigay, kailangan niyo po ng gamot para sa hemorrhoids. Di narinig na yun ng katabi niya. Diba? Okay, so ingat-ingat lang, class, sa so what you say in the butika. Especially if the condition is very sensitive. Kaya halimbawa, lalo pag HIV, okay, ang hirap magsalita. What about for patients with speech impairment? So speak slowly, face the patient, let the patient finish speaking, provide writing pads. Alright? Especially kung stroke patient yan, class, medyo impaired na minsan yung speech nila. And learn simple language if used by the patient. What about for patients with cognitive impairment? So speak slowly, allow time for the patient to answer the questions, and then write the information down. Or what about for patients who doesn't want to see their doctor? Explain your reasons or concerns to be assertive. Halimbawa, sabi mo, ma'am, magpatingin na kayo sa doktor. Pero nararamdaman mo parang ayaw niya. Explain mo class kung bakit. Kasi sabihin mo, kasi ma'am, pag lumala po yung condition nyo, pwedeng mas ma-hospital ka. Pag na-hospital ka, mas mahal ang magagastos mo. Alright, so sabi nyo, wala na kayong pera, di ba? Mga ganyan. Okay, again, class, these are things that you learn through experience. Now, what about patients with hearing impairment? Okay, ask if the patient can hear you. Ask if better to speak to one side, halimbawa sa left ba o sa right ear niya. Face the patient, speak more slowly. Use short, simple sentences. Keep in mind that your facial expressions, body postures, and gesture are as important as lip movement for the patient to understand what you are saying. Sabi nga nila, class, di ba, in a conversation, 90% is body language, 10% lang yung words na lumalabas sa bibig natin. Halimbawa, sabihin mo, hindi naman ako galit eh. Di ba? Tono pa lang ng boss mo, galit ka na. Okay, despite the fact that you're saying hindi ka galit. Kaya nga 90% class in a conversation is body language pa rin. Tone and body language. Okay, and then lastly, class, if the patient with vision impairment, okay, so tell the patient what you are doing and if there is anyone present. Okay, may bantay, halimbawa yung patient natin. If writing information, use large print and pastel-colored paper rather than white paper. Right? To facilitate lang, class, a better view of what you're writing or the instructions that you're giving. All right? Okay, so are we good, class? Okay, so this is pretty much, class, the last slide that we